to talk about easy to do remedies for adult insomnia.
I don't know if there's a top three necessarily, but a lot of what our treatments, it's pretty structured. It's usually about 5 to 8 sessions. During that time, only a small percentage kind of really improve their sleep. But what the research shows is following them for a year after is a lot higher percentage of people. So basically, a lot of what we teach, you apply long term, and it gets better over time. Unfortunately, there's no pill or quick fix to this kind of thing. But a large part of it I explain is kind of reconditioning your bed for sleep. A lot of people that come to see me, they're spending a lot of time in bed doing stuff besides sleeping, whether it's TV, phones, games, or just staring at the ceiling, tossing and turning. And the way we fix that is by only using the bed for sleep. And another big part of it is getting out of bed if you can't sleep, which seems kind of counterintuitive to some people. What the research shows is after about 20 minutes of not sleeping, you start to associate your bed with being awake. So when that time comes, we actually encourage people to get out of bed, go to another room, actually keep it low light, do something boring. Another big one that kind of goes along those same lines is only going to bed when you're sleepy. Which sounds kind of common sense, but when you're struggling with sleep, you think, oh, I need to go to bed earlier so I'll have more opportunity. And really what you're doing, and when you do that, is kind of making the problem worse. And then just to kind of what I mentioned earlier, a lot of it's based around like relaxation type stuff, really protecting that hour before bed, shutting down from anything stimulating, phones and the work. And TV's okay, actually, if it's something you've seen before, but usually what we'll have patients focus on is a lot of those breathing exercises and meditation type stuff, guided imagery. They say the worst thing you can do is try to sleep. Supposed to let it unfold naturally, not napping, of course. It's kind of like our sleep drive. Yeah, right. I mean, keep it under an hour is what we tell people, or 30 minutes or less. Anytime you nap longer than 30 minutes, you're getting into your deep stages, and that it's kind of like eating a snack before dinner, you kind of kill your appetite.
Right.
Getting up at the same time every morning is real big. Our circadian rhythm's a big part of what controls our sleep. And the way we do that is by having consistency. All back to relaxation. That's really I think the best thing I can give people is, how to relax, especially a lot of our mind's always going. It's real common to hit the bed and have that mind racing. So,
yeah. Oh, yeah.
Just piggyback on, he did a great job of explaining, what we call sleep hygiene techniques.
Mm-hmm.
The only other one I would add, just kind of like a quick thing, is really controlling the light in the room when you go to bed. So if you don't have like blackout curtains, those little night things that they put across, those work miracles sometimes. Those can be very helpful. So that would be another, just a recommendation that I often share as well.